Radiation safety briefing, proper handling and use of sensors and generators. Safety is a really important part of X-ray generation. We want your team to be safe when they're capturing images, and we want our patients to be safe when we're taking radiographs on them. In this training, you're going to learn how to properly position yourself as the operator and your patients so that we can obtain the best X-rays for our patients while staying in the zone of protection or the safe zone for the operator. Let's do a quick review of the parts of your X-ray unit, or what some call an X-ray generator or machine. A handheld dental X-ray unit typically consists of several key parts that work together to take an X-ray. The control panel and display screen. This is where you go to adjust exposure settings and select imaging modes. Many brands have preset modes based on the patient's size and age, like pediatric or adult, and what type of X-rays you want to take, like a PA or a bite wing, which make it really easy to use. Battery. This provides power to the handheld X-ray unit, which allows it to be portable and wireless. Make sure to charge it whenever it's not in use so that it doesn't lose charge while you're seeing patients during the day. The better charged these units are, the better penetrating power they will have, which leads to better quality X-rays. The collimator, a device that shapes and narrows the X-ray beam to focus it on the area we're trying to capture to reduce patient exposure. This is the cylindrical tube that you need to line up with your sensor. Imagine an X-ray beam coming straight from the middle of the tube where you're deciding where to position the sensor and the patient. The exposure button. This is a button that starts the X-ray exposure when pressed. For some machines, you have to hold it down for a few seconds to capture the image, while others just one quick press. The scatter shield. This is a protective barrier that helps to minimize radiation exposure to the operator and any other people that may be close by. On some units, it can be adjusted, but it's really important not to remove this from your device. This is what keeps you safe while taking the X-rays. It's a good habit to also keep the safety strap around your wrist or body when using your handheld. And always be sure to place the unit X-ray down on a flat surface after using it so that it doesn't get knocked over. These are very expensive, anywhere from $5,000 to $10,000, so it's important to be incredibly careful when using them. Now that you know what the parts are and how to operate your handheld device, let's talk about how to position it for patient use. As you can see for the operator, if you're holding the X-ray generator in the correct position, they're in the safety zone of protection. If the generator is moved too far up or too far down, you can see that the operator is now outside of the safety zone of protection. This is why it's important to move the patient, not yourself, if you need to adjust someone to get the best X-ray. Simply ask the patient to move their head, or you can adjust them in the chair that they're sitting in to get the best angle. Moving the patient or chair instead of the X-ray generator to get the ideal position is the safest way to operate the machine. If you have to move yourself out of the zone of protection for any reason, please make sure that you have a lead apron on to protect yourself. So don't forget, it's really important to position our patients correctly so that the operator stays in the zone of protection and keeps the operator and the patient safe while taking X-rays.